Hi, I'm Dr. Jan Jaffer, and this is Got Teeth. So today I'm talking with Dr. Jodi Gergely. Jodi has actually been my partner for coming up to 15 years now. So I've known Jodi for a long time. She's worked with us for a long time. And one of Jodi's passions is, how to make teeth look better and straighter and some of the concerns with misalignment of teeth. So today we're going to be chatting a little bit about adults' teeth and why would we align adults' teeth? Why is there a problem with crooked teeth in adulthood? Because I know I have a lot of patients that come in and they say, I've had these teeth like this for the last 30, 40 years. Why would I fix them now?
Yeah, exactly. We do see that a lot. And there's definitely the people who come in and say, hey, I don't like the look of my teeth. I want them straight. It's affecting my self-esteem. And research does show that people with straighter teeth actually tend to smile more and be more confident. But definitely there's those people who don't have a concern with it. From our standpoint, when we're looking at it, what we'll see is crooked teeth are often harder to clean, and these people would be more likely then to have staining on their teeth, more tartar buildup. As well, they can be more prone to getting cavities in those difficult to clean areas. And it's harder for us to restore those difficult to clean areas as well if they are getting cavities there. The other thing too is we'll see unnecessary tooth wear. So it can get to the point where you're actually wearing through your enamel on the chewing surface and getting into the second layer of your tooth, which is the dentin. And then the tooth wear really accelerates. So it may have taken you 10 years or 20 years to get to the point where we see you at and are having a conversation. And then all of a sudden within 5 years, your teeth have become really sensitive to temperatures and even eating certain foods because you've lost that protective layer of your tooth.
Oh, interesting. So people's bite can actually affect how their teeth wear down over time?
Definitely, yeah. So we can see accelerated wear, we can see bone loss and recession as well. Some people will notice they'll say their teeth are really sensitive around the gum line, and that is where we kind of, or I'll say it's like a notching out at the gum line, and that's just from how you chew. So if the forces aren't vertical forces on your teeth, you can get some flexing of the teeth, and we'll get this notching out at the gum line, which is loss of tooth structure. So it's weakening of the teeth. It's almost like a little beaver coming in, like it would chop a tree down, and the same thing's happening with your teeth, but it's literally just from how your bite is and how the teeth are aligned.
Interesting. So as we look at that, so getting your teeth straightened even in adulthood is not just a cosmetic thing than what you're telling us. It actually is for the health of the teeth and to, actually help people chew and function better over time.
Yeah, definitely. And I would say there's probably half of the people I see are interested in aligning their teeth for cosmetic reasons, and the other half is purely function and to save the tooth structure that they have remaining.
Well, that's interesting because I think a lot of people maybe don't understand that it's important for the bite and it's important for their function. I mean, it can also more than likely affect, if they're grinding or clenching, just other issues that they're having with their bites that can cause, future problems down the road for them if they don't fix this.
Yeah, definitely.
So if somebody now says, okay, well, I do have a problem. I'm noticing, some wear. I'm noticing some sensitivity on my teeth. What are their options? What can they do to make this better?
So if we're looking at aligning the teeth, we definitely have traditional braces, which are usually the metal brackets, or even sometimes people are using the ceramic brackets. And then as well is the clear aligner therapy. And there's different companies out there that produce clear aligners, but the clear aligners are kind of a retainer style of therapy where you go through a series of several different aligners that will move your teeth just like braces would.
And why would you choose aligners over braces? Is there a benefit to the patient? Is it easier for the dentist? I mean, because we're seeing a huge push. I mean, I know you see commercials all the time for clear aligners that are out there now. Is there actually an advantage to clear aligners, or is it a disadvantage, or what are we thinking?
Yeah, so definitely with the clear aligners, there is a lot of advantages. Both aligners and braces, traditional metal braces, will move your teeth adequately, and you can get everything done that you want to do with both. Clear aligners have come a long way. 15 years ago, we were just doing very, very basic cases with them, but now we can do more comprehensive, complex cases that you would have traditionally only done with braces. So we can get the movements that we need with clear aligners. Treatment actually is usually quicker with the clear aligners, believe it or not, as well as the aesthetics. Because the aligners are transparent, people really prefer that, especially for adults, because the whole idea of having braces in adulthood is usually not overly pleasing because of aesthetics and even just cleanability. And that is something that I have really noticed when you're looking at kids in braces and even into adulthood. It's hard to clean your teeth and do a really good job. It's time consuming and you need to be meticulous at what you're doing. So with the clear aligners, it's really easy. You take your aligners out to eat and then you're able to brush and floss your teeth just like you would have before you even started the aligner therapy. And that is one of the hugest advantages, I think, is just being able to maintain good teeth and gum health while you're going through treatment.
Nice. Yeah, I mean, I definitely experienced that because about 8 years ago, I went through a set of Invisalign and definitely found that I was like, okay, I can take it out, I can brush, I can floss, I can put them back in. And, it was easier for me to go through it for sure at that point than consider a set of braces because I don't think I personally would have done it if I had to put braces back on. So if somebody says, okay, you know what, I'm interested in getting some clear aligners, like what's the process of doing something like that?
The process is actually quite simple. So we always have the patient obviously come in for a consult first, and we've got great technology at our offices where what we do is a digital scan of your teeth, and there is software connected with that digital scan technology that will actually show us a representation of your own teeth, what they would look like straight. So before you even commit to treatment, you can see what your teeth would look like when they're all aligned.
Wow, so like in that first appointment, you can actually give me an idea of like a before and after just when I sit in the chair?
Yeah.
That's pretty amazing.
So it's amazing. So you know what you're getting yourself into as well. So you'll come in for that part. If you want to proceed with treatment, I will do more designing, or the clinician who is ever doing your treatment would do more designing with the company, all on the computer. And once we submit the case and accept it, treatment usually starts 2 to 3 weeks after that.
So it's pretty fast. So if I came in for a consult, you could kind of give me a before and after, and if everything looked good within a couple of weeks or a few weeks, we could actually get started with treatment.
Yeah, definitely.
Awesome.
Yeah.
So that actually goes really fast then.
It does, yeah.
Anything else that you need when you're doing it, or is there any are you showing me before and afters just on the computer, or do we get pictures of what's going on? Like, how else are you looking at my teeth to make sure that we can get the result that we need?
Yeah, definitely. We also do photos before and after, and even during. So anytime we're doing any communication with our aligner provider, we are always sending them new photos, and everything's done digitally and in 3-dimension, which is just phenomenal. So we can really have a lot of control over movements and whatnot.
That's pretty cool. Yeah. Because when I did it, I mean, the technology wasn't that far advanced. I mean, we definitely had to hope that some of this stuff would actually happen as opposed to be able to see it ahead of time.
Yeah.
So I've now decided to go through the process. I've agreed to, that we went through the consult. I come back in 2 to 3 weeks. Now what happens? Like, what does the rest of the process look like to get me from where I am now to straight teeth?
Right. So your very first visit, when you come in to have your aligners delivered, we will obviously show you how to have your aligners in and out of your mouth so you feel comfortable putting them in and taking them out, as well as how to take care of them. In your first appointment as well, we do what we call attachments on your teeth. And this is something that's all designed with our technicians and with the software. The attachments are little filling material pieces that we glue onto the teeth, and they're just bonded on there while we're doing your treatment. And the reason for that is that the aligners need something to hold on to move your teeth. So whether we're rotating them or tipping them or moving them up or down, it acts as a handle so that the aligners can move your teeth in the most efficient manner. So that's something to be aware of, and we always make sure our patients know that before they start treatment, that they will have these little tooth-colored bumps on their teeth while they're doing their treatment.
So are those noticeable really, or is it just more of you feeling it? Like what happens when you have these bumps on your teeth?
Yeah, so you do definitely feel them, but you kind of notice them for the first couple days or so. And in terms of aesthetics, we make sure they match your teeth, and you will notice them, but they're not invasive in your face. So I don't know if you can tell, but I'm doing Invisalign treatment right now.
Cool.
And I have some of the attachments on my teeth.
Okay.
And
and you don't even notice them. So that's pretty cool. So they blend in pretty well.
Yeah. So it's kind of, it is really quite non-invasive, and again, more in that cosmetic demanding treatment, which works. It works. That's why the aligner therapy has, I think, at least, is one of the more popular reasons for adults. Yeah.
And then, so I've come in, I've got these little buttons put on my teeth, and I've got the trays. How long would an average treatment plan kind of take? Like, what would be a normal kind of timeline, and how often do I need to come back in to see you to make sure that everything's going properly?
Yeah, great question. So with the aligner therapy now, with the company we use, you're changing your trays every week on average, and you would come in for appointments every 8 to 10 weeks. Now, treatment time is so very variable because it depends on, are you just correcting a few malaligned teeth, or is there a whole mouthful of teeth that we're actually moving? But on average, what I tend to see in our office is most cases are completed in around 6 months, and the more complicated treatments would probably be around a year.
Okay. So it actually goes pretty quick.
It does.
That seems quicker than braces, because I remember braces usually being about 1.5 to almost 2 years in a lot of cases.
Yeah, it's quite amazing. And all the forces, again, because everything is computer and digitally designed, the forces on the teeth are very purposeful and very gentle, and they will only put so much force on a tooth per tray. So it's all very controlled so that there isn't over pushing of teeth causing any negative side effects with it.
Okay, awesome. Well, it was funny, and you kind of already answered the question, but I was going to say, if you had the option at your age to get your teeth straightened, what would you choose? But I think you already answered the question, because you're in the process of doing Invisalign right now.
Definitely. And I've actually had braces twice. So that is, when I was in dental school, I had braces for the second time because I didn't wear my retainers as a teenager and my teeth had shifted. And then, believe it or not, even knowing better, I still didn't wear my retainers again, and am doing Invisalign for aligning my teeth for the third time now. And that is actually something really, really important. And again, something that we talk to patients about to make sure they understand, when you commit to aligning your teeth, you really are making a lifelong commitment. So you need to wear retainers for as long as you want your teeth to be straight.
So, and that was another question. So what happens once you're done treatment? So once you're done treatment, you're given a set of retainers in most situations. Is that how it works? And then those are worn all the time, once in a while? Like, how do we have to worry about the retainers?
Yeah, so with the retainers, so when you're done treatment, we remove all those attachments off your teeth, and we do give you a set of retainers, and you wear them for full time for about 3 months, sometimes a little bit longer depending on the type of tooth movements we had to do. And then we will start weaning you down to just nighttime wear. And the easiest is just to always wear your retainers every night, because then it just becomes habit.
And that probably protects your teeth from a little bit of grinding and clenching along the way too, if you have some plastic.
Definitely. It definitely does. And if you happen to be, especially if you're a grinder, we'll pick it up pretty quickly if we're questioning how much grinding you still do, because it'll wear on your retainer. So we can kind of see how significant the grinding actually is. A lot of people are unaware of how much they grind, or if they even do grind. So it is actually a nice little diagnostic tool for us.
Perfect. So keeping your teeth straight it's a bit of a lifelong thing, like you said. We do want to make sure we keep the retainers on, and so that we don't have the issues, because I ran into the same concern as you. As I had braces when I was like 12 to 14, and then Invisalign at around 30, and now I'm using the retainer system, maybe not as religiously as I should, but it's working for me. My teeth are staying straight, so I'm really happy with the result. Awesome. Well, thanks for your time today. I really appreciate that. Is there anything else that you wanted to add, or is that?
No, I think that's everything.
Okay. Well, perfect. Thank you so much for your time.
Thank you.
All right. Good.